Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode.
Well, Patrick, thank you for talking to us today. And let me get this right. So you started your heart journey through our HeartSmart screening program.
Right. My primary care doctor, Mark Dyer, suggested I do the HeartSmart screening, which I'm glad I did, like in early 1st of September, I think.
Okay.
And I came in, did all that, and then I came back and met with the cardiologist upstairs, Dr. Rodkema, and he was telling me that the CAT scan part, where they check on the calcium deposits and all that. And I was like in the 95th percentile the bad way. But a good score is like 0, mine was like 3,200. So they figured I had some blockage.
Yeah. Backing up a little bit to the screen, what prompted your doctor to say, hey, you might want to go get this heart screening?
I'd not had any kind of problems or anything. I'd get out of breath sometimes walking. I thought I was getting 73 years old. I never had any kind of chest pains or any other kind of symptoms.
Yeah.
But he just sort of recommended that as a preventive kind of thing and thought it was a good idea at my age and all to do it. I'd had a prostate surgery at St. Vincent's, as a matter of fact, in 2017.
Okay.
Never anything like this. So
yeah.
It was just sort of, wasn't anything specifically that he recommended it on. But
yeah. So when you came in for the HeartSmart screening, tell us a little bit about that process. Like, what kind of tests did they do? Was it easy, hard? Tell us
it was real easy. They did I think they weighed me, did blood pressure, did a few measurements on BMI, I guess it is, something like that. And then the only real test, I did the CAT scan down there in the hall where you lay down and they do the machine over and get that. And then I went back and they did I don't know what they call it, it's like it wraps around your leg, these sleeves.
Yes.
And does pressure, just checking out the blood flow in your veins, I guess, and all that. That came back fine.
Good.
So, I think that was about it. There may have been one other walking for a second, but there really wasn't a whole lot of other stuff involved with it. It was real simple.
How long did it take for you to get your results from the screening, and did they call you to let you know, hey, you might want to see a cardiologist?
I think they called, and I think Dr. Dyer called within about 3 days.
Oh, wow.
Pretty quick.
Okay.
And then recommended to meet with the cardiologist over here, which I did, and they immediately, within a few days, scheduled heart cath over at St. Vincent's and did that. And then the surgery like a week later. So
yeah,
it was all sort of boom, boom, boom. So I went in and did the heart cath. I was hoping I could do some stents or something at that point, but where the blockage was and all the other, it really couldn't.
Yeah.
So they recommended meeting with the surgeon, which I did with Dr. Howell, and then had surgery on the 18th, September 18th.
Oh, wow.
Ended up doing 3 bypasses.
But, it prevented you from having a heart attack.
Right, well, that's what everybody said, that, the fact that they caught mine ahead of time, it's not great to have that blockage like that, but when you do have a heart attack or a stroke, you can get damage to heart muscle or valves and all that kind of stuff, and I never had any of that.
Which, that's fantastic.
Which is really good, so.
Yeah, because you didn't have any damage to your heart muscle. So, by just listening to your doctor to come do the screening, really prevented what could have been a major heart event.
That's what they say, because again, based on the amount of blockage that I had and stuff, it was, you're walking around.
A little bit of a ticking time bomb?
Ticking time bomb, that's a good way to put it. So, I'm glad I did it and appreciate Dr. Dyer recommended that. I'm glad this was available, so
yeah.
I feel very fortunate on that. So.
Wow, that's exciting. So, tell us a little bit about heart surgery. I think a lot of people, it's something scary, right? Nobody wants to hear you have to have heart surgery, but tell us about like your recovery process, like once you went home after your surgery. How are you doing, feeling? Did you feel any instant change in how you felt? Or tell us a little bit about that.
I had a little bit of knowledge about it since my father had bypass surgery in '98.
Okay.
Which of course is a little bit different nowadays. That was at the heart hospital, I think. But so I knew something about it. And also I was fortunate my brother had retired really in August, so that he was available as a physician to help me walk through stuff and understand things. And his wife, my sister-in-law, was a former cardiac nurse.
Oh.
She actually used to run the cardiac something lab over at the Baptist Hospital, so I had really good backup. I had a better idea of what to expect. And when we met with Dr. Howell first, right after I did the heart cath. They checked, and he was doing office visits that was Wednesday afternoon, I think. So I was able to see him late that afternoon instead of waiting another week.
Yeah.
And he explained stuff, and then did some diagrams of showing where the blockage was and different stuff. And then, of course, he didn't know at that point what he would get in there and find. But
Sure.
recommended, so they explained everything. So that was, it's intimidating, but I had a lot of good information, so I wasn't just going in blind on it.
What are some things that if someone that's watching this gets that diagnosis that they'll need heart surgery, what are some things that you think would be helpful for them to know, especially through the recovery process?
Well, when I went in, or when I got through the surgery, my main problem was getting the insurance to approve going into some kind of rehab, which the doctor had recommended. But the insurance, I got into a managed care plan last year, which I'm out of now, which I shouldn't have done. And found out they were real strict on trying to approve anything. So I finally got out of the hospital and I went to like a smaller rehab kind of thing out in Sherwood.
Okay.
I was out there about 10 days. And then I got home, I think October 9th. And I was just wanting to get out of the hospital and out of the rehab before my birthday, which was the 15th of October, which I did. At that point, I was set up to have a home health nurses or a therapist coming in, so a physical therapist and occupational therapist came in like three or 4 days a week.
Okay.
For a couple of weeks. I had that already set up when I was coming home.
What did they help you do when they came home? What were some of the things those nurses were helping you try to do?
Just trying to build your stamina up, did a lot of walking initially. Not going to walk by myself, but I also had a walker that I was using for a while when first. And then the occupational therapist was doing more range of movement stuff, some real like 2-pound weights.
Okay.
And stretching exercises and a few things like that. So it's real basic kind of things like that.
Yeah. Did that help you just feel like?
Very helpful. Initially, even in the hospital, it was tough for me even to get up and try to walk around the hall. They try to get the physical therapist when you're still in the hospital after surgery to start doing that, but I was just so weak. I had no idea. My brother told me that it would probably just knock you for a loop. More so than I thought.
Yeah.
Gradually, really quickly, it seems like now, but it's real gradually, just building your strength back and your stamina. Just like walking in the house, and then they get you out walking down the street in your neighborhood.
Yeah.
It's different walking like on your driveway or on pavement than it is on a wooden floor.
Yeah.
And trying to walk far enough where you can carry on a conversation without trying to catch your breath and all that. So it's
just kind of rebuilding your heart stamina because you don't realize how much energy just even talking, takes, or just sitting up in a chair or walking to the kitchen or the bathroom or the mailbox.
Yeah.
You kind of take that for granted until you realize, oh man, that takes a lot of energy. So, at what point did they recommend cardiac rehab?
I guess it's when I had like about 2 weeks, I think, of the home health coming in.
Okay.
And then I was back seeing Dr. Rockema, and they probably told me this early on, that they have a cardiac rehab, which is a good way to do it. And I said, well, I'd like to do that, I think, instead of just immediately going back to athletic club. I feel like I could do what I did. I was big on doing a rowing machine when I used to go to the club. Before we started doing that again, did a lot of walking.
Yeah.
Steps on my Fitbit. So, they told me all about it, and I thought I'd come check it out because they're monitoring everything. And it's really been great. I really enjoy it. I don't enjoy it all the time. They push it.
It's a love-hate relationship, right? They push you further, but
it's very beneficial. I recommend anybody go try that out. You got a treadmill, you got some stationary bike kind of machines, real light weights.
What's the hardest thing for you to do in your cardiac rehab workout right now?
probably just getting through the, I'm doing like, started off doing maybe 8 to 10 minutes, like on the treadmill or on this new step machine. It's like a sit down or rowing bike kind of thing.
Okay.
It's building up, doing 20 minutes at a time, and they bumped the intensity up a little bit, so it's a workout.
It's a workout.
Well, the fact that it is monitored, they've got what they call it, little sensors on you, where they're looking at the EKG the whole time.
Yeah.
Monitor what's going on, monitor your blood pressure a couple times before and after all the sessions. Whereas at the club, I didn't feel like I would have had any kind of problem, but just the fact that it was checked out, so they knew what was going on, so you don't overexert yourself.
Yeah.
You don't get into any kind of problem. And so I thought that was real beneficial.
It probably makes you feel too a little more at ease about pushing yourself. Because sometimes when you have surgeries, you can get afraid to do too much. Like, oh, I'm going to hurt myself, or I don't want to hurt my heart, or I don't want to hurt my incision, or, whereas when you have medical professionals that are looking at all that, they're like, oh no, Patrick, you can keep going, but you can push a little harder.
It's also the fact that I have that support system with my brother and sister-in-law here, both medical professionals, and they can explain stuff, and they're recommending all that. So, the cardiac rehab is a great program. And I try to keep it moderate, but I get a little bit above, not quite getting heavy or strong. They ask you weight rate. How was that when you whenever you were doing this, as far as how strenuous it was?
Oh, sure.
So that's good. I can work up a sweat doing it.
Yeah. Check your work off for the day. Go home later, rest, take a nap, watch a TV show. That's right. That's right.
Tell my cat about it.
That's right. Tell them how you did. Tell them your progress. Did you ever go through bouts of, sometimes after you have major surgeries, physicians can say you might have a little bit of feelings of depression, or as you go through the healing process. Did you ever go through any of that where you felt down or a little depressed? And if you did, was there anything you did that kind of pepped you up to let you know I am making progress?
Not really, maybe mildly, just sort of trying to feel like it's taking too long, or it's a slow process of building your strength back up. Just being so weak, I felt fine. I've never had any kind of major pain, which I was figuring you get your chest split open, it's going to be terrible, but it was not at all. It surprised me. And also, I remember my father had the bypass surgery in '98. It was a much bigger thing, taking the veins out of your legs. Now it's like a little endoscopic, or whatever they call it.
Oh, yeah.
Small incisions.
Just a tiny little slit.
And so the pain part was really, I was surprised that was better than I thought it'd be. But it's mainly just working your stamina back and being able to walk.
Yeah.
Just simple stuff like that, Of course, for the first 6 weeks I couldn't drive. And the whole first 6 weeks you're not supposed to lift, pull, or push more than 15 pounds.
Yeah.
That was a big thing in the hospital, and even through the first 3 of us getting used to so used to pushing up out of a chair, or I was, or pulling yourself up. You couldn't do that. You have to try to build your core and working on that. So that was good to do that. I'm glad I did it. So
did you have the pillow?
I've still got that. It's still on my bed with me right now.
You got that pillow, and they're like, if you have to cough or sneeze or hug the pillow.
Hug the pillow and all that. So that's a great idea. So
yeah, and it just, I was telling you before we started airing, about 8 or 9 years ago, my mom had to have a triple bypass, and they found her similar. And man, she found so much comfort in that pillow.
Well, it's a security blanket, for sure.
She was just like, I gotta take my pillow. Gotta have my pillow. So, yeah. It becomes an emotional attachment almost for you, the pillow.
Just keep a positive attitude about it. Nothing's going to happen overnight. We just take time, do what whoever you're working with. It's usually a physical therapist or an occupational therapist. They know what they're doing and follow their recommendations, and it slowly gets better. And I'm not running any marathons, but I feel great now. I'm doing stuff. So
I would also say too, if a home health nurse is offered, definitely take it. It sounds like.
I do, and I didn't know when they were saying getting home health care, we get somebody coming in and checking blood pressure, but it was more, I just had 2 different therapists came in during the time, so they were again very helpful on doing stuff. And they gave you some other exercises you can do on the days that they're not there.
Yeah.
And you're practicing stuff, just standing up and sitting down in the chair 4 or 5 times, that's helping build your core.
Oh, yeah.
and gradually become, more steady. Again, I used the walker for about a week, just as more of a psychological thing. You feel like you want to be steady, but I was fine getting around. So,
yeah.
Anyway, it's just a process.
Well, that's wonderful. Is there anything that you would that I didn't ask you that you would want people to know about either the HeartSmart screening program or not being afraid to find out what might be going on even if you don't have symptoms like you didn't? You didn't have any symptoms. Well, it sounds like you had a great experience. You're doing great. I think you were saying you have how many cardiac rehab appointments left before you're let loose in the world?
I think I got 6 more.
6 more.
Graduation. They did a little graduation ceremony.
There you go. Did you think at this age you'd be graduating again?
I did not.
Well, we're so glad you're graduating again.
I am too.
And we're so glad that you took a few minutes to talk to us today. And we hope that Patrick's story helps one of you guys, if a family member or even yourself is at a point in your life where you want to check out your heart health. Definitely do that. As Patrick said, there's a HeartSmart screening program here at CHI St. Vincent. So don't put it off. It's Heart Month. It's never too late. Thank you.
Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey, and we hope that you'll join us next time.